KKGO HD1 Los Angeles, Orange County at GoCountry105.com and available on the iHeartRadio app. Go Country 105.
Tuned In was recorded earlier for broadcast at this time.
Welcome to Tuned In with Mike Johnson, a public service of Mount Wilson FM Broadcasters and Global Jazz Incorporated. Now, here's Mike.
Thank you, Al Verdi, and good morning, everybody, and welcome to Tuned In from Mount Wilson FM Broadcasters and Global Jazz Incorporated. Health is our focus this morning here on Tuned In. A little bit later, we will be chatting with Dr. Mark Kerner of Cal West Head and Neck Surgical Institute, as we will examine the differences between the sinus issues that people are going to have this time of year and the COVID-19 symptoms. And to begin this morning, my guest is Dr. Mariella Hession, and she is the Medical Director of Breast Imaging for RadNet Imaging Centers based at Los Coyotes Imaging and Women's Center in Long Beach. And we're going to be talking about the importance of mammograms, especially during the ongoing COVID-19 pandemic. Dr. Hession, good morning.
Good morning. How are you?
Good. Thank you for being with us this morning. You know, it's the sort of thing where, of course, there's so much activity going on and so many things happening in this world right now, and health is still primarily a vital thing for everybody listening to this radio program. Mammograms. Let's talk about them for a moment. Having a mammogram this time of year, especially with the pandemic, is it more problematic?
Absolutely, Mike. Ever since it started about almost 4 months ago, since March, things have dramatically decreased in terms of our volume for screening mammograms. You know, women are being told stay at home, shelter in place, stay safe. So a lot of mammograms have been put on hold for a lot of women out there, which, you know, mammograms as a screening tool still remains our best tool to catch cancer at an early stage. Breast cancer currently accounts for over 30% of all cancers found in women, and unfortunately, we're expected to have over 200 newly diagnosed cancers in the United States alone, 200,000. And my concern is, you know, the COVID is happening, and of course, it's very important to pay attention to this new disease. However, cancer does not take a break. We need to continue, you know, screening our women safely, of course, with all the necessary precautions so that we don't miss these low-stage cancers that are, you know, the most susceptible to having the best prognosis for survival in the future.
One of the things that I know is talked about so often in the media is that people who have other conditions are more susceptible to COVID. It's been so prevalent in the media. And I think the idea here, especially if you need a mammogram, is if you don't know you actually have breast cancer, you may be setting yourself up even worse than you realize, aren't you?
Oh, of course, yeah. I mean, the goal of mammography is to pick up cancer when the woman has absolutely no symptoms. So my goal is that every woman that walks through my door does not have a concern, so that we are able to find cancer at stage 0, 1, or 2, in which they will actually be cancer-free and have the best survival. So unfortunately, you know, when the woman comes in with a diagnostic complaint, meaning they have a lump, a pain, a change they've noticed in their breast, by that point, you know, the cancer is expected, if it is cancer, to be at a much more progressed state.
And giving a handle on that, I mean, again, it's complex enough when the pandemic is not happening. But there's so many, of course, other layers now. And as we've all been told, people have been told, as you say, to stay home, shelter home, and people are not going out nearly as much as they have been. I think there are some people who are afraid to go to the hospital now, even for, quote, a normal mammogram, just because they're afraid of getting coronavirus. What would you say about that?
Yeah, no, absolutely true. You know, fortunately, we are a self-standing clinic. So RadNet prides itself in providing outpatient imaging to patients away from the hospital setting. So we're able to control more of that exposure. So we don't have patients here that are actively going near an ER, you know, that are being admitted or anything. And what we do at our centers all over the country is that we have multiple layers in which we ensure safety for our patients. It starts by doing a questionnaire at the time of scheduling. Have you ever had a fever within the past 24 hours, a cough, new onset of shortness of breath, loss of smell, taste? All the symptoms that have been associated with COVID are being screened at the time of patient scheduling. In addition, once they come into our office, we do an additional screening to make sure that no new symptoms have developed since the scheduling. And then, of course, one of the most important things that I find is that masks are required for every patient entering our building and every personnel and staff that's working at our location. So I feel that all those precautions that we're taking, in addition to, of course, hand washing, which we've seen, all over the news, is one of the, most important things that we as consumers, as patients, as people, as humans can do to, help those people that are more susceptible to the COVID. So I feel that RadNet and all its imaging centers are taking all these necessary precautions to ensure safety for, every patient that walks through our door and for all the staff that are working here.
My guest is Dr. Mariella Heschen, and she is the Medical Director of Breast Imaging for RadNet Imaging Centers based at Los Coyotes Imaging and Women's Center in Long Beach. This is tuned in from Mount Wilson FM Broadcasters and Global Jazz Incorporated. Doctor, now there has been some talk in the past, we're going to get away from the COVID just for a moment here, about the proper time to begin having mammograms. And I know there's been some talk in the media and there's been various opinions about how young women should start getting mammograms. How young do you think women should be when they have their first mammogram?
Oh, absolutely. This has been a controversy that we've, managed and dealt with for the last, since I started my practice, which was back in 2014. So I follow the Society of Breast Imaging and the American College of Radiology, which states that every woman starting at the age of 40 should be screened annually for breast cancer. However, if you have a strong family history, meaning a first-degree relative that has been diagnosed premenopausal, so usually before the age of 50, then that woman should start screening mammography 10 years prior to the age in which their first-degree relative was diagnosed. So, for example, if you're a 35-year-old woman and your mom was diagnosed at age 45, then you should start at age 35. So that's 10 years prior to your mom being diagnosed. I strongly believe in this just because, the volume that I have here, I'm able to see women of all ages. And believe me or not, we find cancer in 30-year-olds every, it's not a rarity. It's actually what we see every month. So I feel very strongly that we should not take away this right for a woman to have. Benefits versus risk. Getting radiation at age 40 and beyond is not going to have any detrimental effects on you. A lot of people talk about the fear of coming in and getting a mammogram and waiting for results. And it's just, taking... It's sort of like, what's the benefit of getting a mammogram? And I feel that the benefit outweighs that fear, outweighs the compression. It's not a painless procedure, which is something that many women try to stay away from, but it's a procedure that can potentially save your life.
My guest is Dr. Mariella Heschen. She is the Medical Director of Breast Imaging at RadNet Imaging Center based at Los Coyotes Imaging and Women's Center in Long Beach. This is tuned in from Mount Wilson FM Broadcasters and Global Jazz Incorporated. Doctor, as we talk about these things this morning, and it's so important that women, of course, self-check, making sure that people actually understand how to properly self-check. How does that process begin? How do you actually understand what to look for?
So that's a very important question, Mike. A lot of women say, I don't know what to do. I don't know what to look for. The most important thing that a lot of people stress is, try to, especially for women that are in premenopausal, so prior to getting menopause, do it at the same time every month. Do it at the same time during your period cycle because your breasts change in terms of swelling, inflammation during your period, so during your menstrual cycle. The best way to do it is to do it standing in the shower where you're able to, palpate for any new findings. And the most important thing is what you're looking for is a change in your breast. We tell the women, your breasts better than anyone in terms of how they feel, changes, how they look. So we're looking for lumps. We're looking for skin changes, any sort of dimpling, any changes to the skin. Thickening is a big one. Nipple changes. If you start seeing scaling, any redness or inflammation in the nipple, discharge, fluid coming out from the nipple. The most concerning colors are white, are clear, and red. So those two colors are like red flags for us as radiologists to look for something, to be very careful and make sure we're not missing something. A lot of women have pain. Bilateral pain is more common and it's more of a benign finding, but when something is focal and doesn't go away, that's a very important sign for you to seek attention, go to your doctor, get a clinical breast exam, and then get the referral to get the imaging done immediately so that you can, be able to exclude worst case scenario.
Making sure that you know your body is so important, of course.
Very important.
And when I think the key thing here that you're kind of getting at is if something seems a little bit off, it's probably worth getting checked out.
Absolutely, especially during this time, Mike. Like a lot of women say, I'd rather be safe. I don't want to go out and get something. But it's very important. A lot of doctors right now are doing telemedicine. So you're able to ask those right questions to your primary care doctor, your OBGYN, and then they can further triage you to see whether you need immediate attention and immediate imaging. And that's very important for people to know that there's more ways to get, further help than just walking into an office. You can actually also be, have conversation with your doctor via, a Zoom, those Google chats, all those different methods that are coming up now.
Yeah, you actually read my mind. I was about to go down that road. If there's someone who really is just having an issue enough, being a little bit scared of COVID, are Zoom meetings available? Or are they practical for what this is?
They're practical to have with your primary care doctor and your OBGYN. But once it comes to imaging, of course, you have to step out of your house.
Sure.
But it's very important for women not to have that thing in their mind saying, oh, I have something, I have a change. Is it important enough for me to step out of my home? So I think it's very important for women to know that option exists, that, having telemedicine, whether it's with your primary care OBGYN or whether it's through an urgent care Zoom conference, it's very important to just know that, your concerns are being heard.
Comfort level, of course, is such an important thing for anybody, and especially if anyone is concerned that they are experiencing breast cancer. When you talk with patients, what's the biggest concern that most people have?
That's a very good question. So there's different levels. So there's first where we find something on imaging and we let them know that they need a biopsy. Of course, at that point, everyone's mind is worst case scenario.
Sure.
So at first, I try to, calm the patient and let them know, we are taking this one step at a time. Right now, we're seeing something abnormal. We don't know a name to this yet. Once we get the pathology back, then we can discuss. And most patients right now, of course, are concerned with what's going to happen. The COVID is happening right now. A lot of surgeries are being put on hold. A lot of treatments are being put on hold. So a lot of women are saying, why do I want to know right now? I don't want to be immunocompromised during this period, which is a very legitimate concern. Of course, right now we're no longer in March, April. We're more towards mid to late June. So a lot of these surgeries have already started happening again. A lot of women previously in the last month the ones that we did diagnose, started taking hormonal therapy if their cancer was able to react to that. So even though the surgery was not happening immediately, they were able to get additional treatments to prevent the actual mass tumor from growing. So, there's other options besides just surgery and radiation. There's other things that can be done during these times.
Dr. Mariella Hession, thank you for being with us this morning.
Oh, of course. Thank you so much for having me.
It's Dr. Mariella Hession. She is the medical director of breast imaging for RadNet Imaging Center based at Los Coyotes Imaging and Women's Center in Long Beach. And, we're talking